My name is Seth from the Center for Thyroid and Parathyroid Surgery, and in this video we will be discussing a fine needle aspiration, or FNA, which is essentially a biopsy procedure that's performed in the office. For an FNA, we are usually biopsying a thyroid nodule or lymph node to rule out cancer in the thyroid nodule or a possibility of thyroid cancer spreading to a lymph node. With the fine needle aspiration, what we're essentially doing is using a hollow needle to core out a sample of cells from that thyroid nodule or lymph node, extract those cells, place them on a slide for pathologists to look at. That's essentially the purpose of a biopsy. This biopsy does not increase the risk of spreading cancer if present. There's been well-documented research that the risk of spreading cancer is basically zero, so there's no concern of spreading cancer with the needle. Thankfully, because of that low risk, we can actually perform, make a diagnosis for thyroid cancer without having to require surgery. An FNA is performed in the office, usually in a normal exam chair that lays back and gets you into a comfortable position. The skin overlying your thyroid nodule or lymph node is numbed. In order to do that, you feel a pinch of a needle go through the skin, followed by a burning, stinging sensation that lasts for about 1 to 2 minutes and goes away. Essentially feels like a quick bee sting, and that's usually the worst part of this whole procedure. Next, I use an ultrasound to visualize and guide the needle directly into the thyroid nodule or the lymph node. You should not feel the needle go through the skin because it's going to be numb. Unfortunately, I cannot numb everything deep in the neck or inside the thyroid gland or inside the lymph node. As a result, when the needle goes deeper, you may feel a little bit of pressure or a little bit of discomfort. Whatever you feel can sometimes radiate to the jaw or the ear or your head. The reason being all the nerves in the head and neck are connected. So if that happens, don't worry, I promise you it's normal, it will go away. The needle's in place for 5 seconds or less. During that time, you may feel pressure going in and out as I'm using the needle to core out those cells again. During that 5-second period, I do ask that you try to stay still. So no turning your head, no talking, no swallowing. Afterwards, I take the needle out and squirt the cells onto a slide again for a pathologist to look at under a microscope. Now, if they do not get enough cells to look at, they will not be able to make a diagnosis. We'd have to bring you back to repeat this, and I don't want you to have to go through this a second time. So I perform 4 needle passes with separate needles in order to make sure we get enough cells for you. So that's a total of 5 needle passes, needle pokes, I should say. 1 for the numbing medicine, 4 for the cells. It seems like a lot, but honestly, it goes by quite quickly. The whole process takes about 10 to 15 minutes. Now, if you have multiple thyroid nodules and or lymph nodes that are going to be biopsied, you would add another 3 to 5 minutes for each one of those nodules or lymph nodes. Additionally, additional lymph nodes or thyroid nodules. You will also require 4 additional needle passes for each of those thyroid nodules or lymph nodes, and possibly more numbing shots. Once I'm finished, I clean you off and put a Band-Aid on. That Band-Aid can come off the morning after the procedure. Once it comes off, sometimes there could be a little bit of swelling or bruising in the skin. That's present, usually goes away over the course of several days. You can expect a little bit of soreness in that area for 1 to 2 days. Tylenol or ibuprofen is great if it's bothersome. Ice packs or wind flows as well. There are no activity restrictions, even on the day of the surgery. So you can drive, eat, drink, exercise. You can even drive yourself to and from the procedure. If you have a lot of anxiety, you want someone along to be there with you, that's welcome to do, but you can come on your own. It takes 2 business days to get the results back. I will, if everything is benign, call or send you a message through our messaging portal and arrange for a 5-year surveillance program based on our up-to-date guidelines to make sure that that thyroid nodule does not change moving forward. If it's positive for cancer, I would call you over the phone, certainly, to let you know those results, bring you back to the office to discuss surgery, which is the preferred treatment to treat thyroid cancer. The risks for this surgery are pretty rare. There's a less than 1% chance for causing infection. Signs of infection would be swelling and redness, as well as pain in the neck. If that's going on, you call the office right away. We would start you on antibiotics, which usually treats that. You do not need to be on antibiotics routinely for this. There is about a less than 1% chance for bleeding by putting a needle into a thyroid nodule. If bleeding were to occur, you could have significant swelling and bruising in the neck that could last up to 1 to 2 weeks. Very, very rarely can that continue and cause lots of pressure, difficulty breathing or swallowing, require you to be admitted to the hospital to control that. Very, very rare if you're not on a blood thinner. If you're on a baby aspirin or a single blood thinner, that risk is about 1%. If you're on multiple blood thinners, that risk is higher, and we would request that you come off at least one or all of your blood thinners prior to this procedure. But if you're taking baby aspirin or just one blood thinner, it does not need to be stopped prior. So that is the fine needle aspiration. That concludes our video. For any more information on fine needle aspirations, thyroid nodules, thyroid cancer, any topic on thyroid or parathyroid glands, please visit my website at sethkmd.com. That is SETHKAYMD.com. And thank you for watching.